Hi, I'm Dr. Dan Casasilla with Sarasota Neurology, and we're here today to talk about matrix platelet-rich plasma. And we're fortunate to have Nicholas and Dee here today, who have both received platelet-rich plasma therapy, Nick for his left knee, and Dolores for her right foot pain. And they both received PRP, and they're here and were kind enough to come in and tell us their stories about how their experience with PRP was. Thank you so much for coming in today, and I'm excited to hear your stories. I think we'll start with Nick. Now, how did you hear about the PRP therapy?
I heard about it just coming to your office.
Just coming in the office, okay, and we have some signs up here.
Yes, you get a bunch of signs, and the wife comes in for her headaches. And
so you didn't originally, you were just here as an innocent bystander then?
That's exactly right.
And you saw the information we have in the office on PRP.
Right, yes.
So you saw that and you asked me about it, and we
Yes.
saw you for your left knee pain because you didn't want knee surgery, is that right?
That's correct.
And you were having a lot of knee pain.
Right.
And you had a torn meniscus?
No, I had I'm bone on bone. I went to and saw a doctor, and he x-rays it and told me I was on bone to bone.
So you were bone on bone, which is
Yes.
far worse than a torn meniscus. And they were looking at a knee replacement?
Yes, but not not right away, but they said down the road I'm going to need.
So you were facing a knee replacement at some point. And you didn't want to have an artificial knee.
No, I did not want an artificial knee. They gave me a knee brace. I had a knee brace, and I used it different times.
But you were still having knee pain?
Yes.
Okay, so we saw you for consultation. You went ahead and had the matrix PRP therapy.
That's correct. Yes.
Tell us about your experience with that.
It went wonderful. I couldn't believe how you just took a little blood out of my arm, and half hour later, or an hour later, you put it in my knee, and I walked out of here, and in 3-4 days, the pain went away.
Oh, that's great. And then the normal. So what you were saying is you had the injection of PRP in your knee. It was a single injection, correct?
That's
Did
correct.
you have any more treatment than that?
No more treatment.
And we didn't have to, and you walked out of here
I walked out
with
of
a
here.
Band-Aid on your knee.
That's
that
correct.
was it, right?
That was it.
Was that the whole treatment?
That's all the treatment.
Any rehab or anything?
No.
No rehab, so you didn't need rehab. And we told you that. You didn't need rehab.
That's correct.
And I said, I'll see you back here in 90 days, which is the normal healing time for platelet-rich plasma therapy pretty much anywhere in the body. Mm-hmm. And so after 90 days, how were you feeling? You said in 2 or 3 or 4 days you were already feeling
great. And I had a watch going up and down the steps, but otherwise everything went great. And then in 90 days, the pain was gone.
That's fantastic. And how long did you stay pretty much pain-free?
Well, I would say another half a year.
So 6 months at least.
Yes.
And then bone on bone, that's a little more difficult to treat, as we indicated. And so would you have little twinges of pain or little minor pains? Or it's not as bad.
Pain.
Was it as bad as it was before you had the PRP?
No.
So are you still pain-free most of the time?
Most of the time I can walk. At one time I couldn't hardly walk anymore, and now I'm walking. I mean, I'm taking a mile walk at a time.
Wow. With a knee brace or not?
No.
No knee brace?
No knee brace.
It's amazing. And you're not taking any medication for that?
That's correct.
Fantastic. So if somebody asked you, well, should I consider having matrix platelet-rich plasma therapy, or should I just go for the knee surgery? What would you tell a patient?
I would go
or your friends?
I tell everybody you need to go see the doc and have the PRP taken care of it.
So if your knee pain worsened at some point down the road where it was more often having pain than not, would you go for PRP or surgery?
No, I never will go with surgery.
So you'd come in for more PRP?
Yes, definitely.
And that's not unusual in patients with bone-on-bone arthritis in their knees, because we have to keep regenerating the cartilage. And so the PRP did a good job on regenerating the cartilage in your knee. But as it wears down because of the arthritic changes in your knee, we may have to give you an additional treatment. I believe I explained that to you perhaps 1, 2, 3, 4 years down the road.
Right.
But it would just be another simple shot like you indicated.
That's correct.
Great. Well, I want to thank you so much for sharing your story. with us here today in the audience to hopefully help people to avoid having knee surgery.